Hi again, Dr. Robert Strang, Chief Medical Officer of Health. Today we're announcing another 17 cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 68. Like the others, these cases remain related to travel or by direct connection to earlier reported cases. We know that several of the cases are connected to groups or families who have returned to Nova Scotia after traveling outside of the country. None of the cases so far are resulting from spread within our local communities. Of the 68 individuals affected, they range from under 10 to mid-70s. 2 of the individuals we know have recovered fully from their illness and can be considered resolved. 1 individual remains in hospital. To date, a total of 2,772 Nova Scotians have been tested negative for COVID-19. The fact that we're getting 17 cases today, 13 yesterday, we actually expected this. We knew that many Nova Scotians would be coming back after traveling for March break. We put things in place to require them to be strictly isolated for the 14 days after they got back, knowing that many could become ill with COVID. We set up 811 so people could actually be assessed online without having to go into a healthcare facility. And we've set up testing centers so if people where appropriate can quickly and efficiently get in for testing. The fact that we're seeing in all our cases, on average, we're seeing just around a little under 2 close contacts for every case we're identifying. That means that Nova Scotians are following the rules, that they are self-isolating when they come home, and when we get sick and we do our case follow-up, we know we're seeing that they haven't been out in the community and they've had very little interaction with other folks. Many of the cases, many of the contacts have been that have now tested positive have been close household contacts. So the things we're putting in place are working. What's really important that we have a chance in Nova Scotia. We're 2 to 3 weeks behind some other provinces that have much greater numbers and many more challenges with COVID-19. They're putting in place the tough measures that we're putting in place at about the same time. If we all stick with together the public health measures that we need to do, strict hand washing, cough etiquette, staying away from others if you're sick, social distancing, and adhering to all the things that's around mass gatherings and the businesses we've closed down. If we all do that and do it well, we have a real opportunity over the next few weeks to substantively decrease the likelihood of a great number of many more cases here in Nova Scotia, decrease any spread. We are likely going to see some community cases, but if we're doing all the things that we're from public health that we're either telling or asking you to do, we can minimize the ability for that virus to spread in our communities. So now is the time that we all act together. We can really have a significant impact. But it's not going to be over tomorrow. We're going to have to stick with this for at least a few more weeks. I recognize the imposition that creates, the disruption to people's lives, but we do need to do this to protect each other and to keep our communities safe. I also recognize that this can actually be a very fearful time. Along with the disruption, the concern about the virus can create fear. We haven't been in a situation like this, virtually all of us. It's been generations that haven't had to deal with a crisis of this magnitude. So that fear is normal and understandable. And so we need to be open about that. It's okay to tell other people that you're afraid. What we do with that now is really important. Getting a sense of control yourself is really important to help manage the fear. So all the things that we're saying, what can you do within your life around good hand washing, maintaining social distance, all those things, you can have a sense of control because they actually will have a significant impact on whether you get sick or not. The other thing is reach out and talk to people. Now's the time for us to, even though we're saying to be physically distanced from each other, we need to increase our social connectedness. So talk to somebody, reach out and tell somebody how you're feeling. We have lots of devices now that can allow you to do that. Or reach out to somebody else in your community that you may be feeling good, but somebody else may be having some challenges with how they're feeling, or they may need some support to get groceries or something like that. So reach out to each other. Let's look after each other. Let's approach this not out of fear, but with a sense of caring for each other, building community, and using common sense.